afternoon, everyone, members of the media, and thank you for coming. I'm joined today by the Minister of National Security, the Minister of Health, the Commissioner of Police, and the Acting Commanding Officer of the Royal Bermuda Regiment. By now, the additional social distancing measures that I announced yesterday have come into effect. And in addition to those activities previously suspended, retail stores, cinemas, and bars are closed for a period of 7 days, and restaurants are limited to takeout service only. Whilst there are penalties in place for failing to observe this order, my hope is that we will see 100% compliance. This is about saving lives, and that is an effort in which we must all be united. This 7-day period of enhanced social distancing, or this initial 7-day period of enhanced social distancing, is to allow for us to assess where we are as we continue to ramp up our local testing regime. As I indicated yesterday, the more we test, the more we know. And I can advise the public that all 16 of the testing results received today have now returned negative results for COVID-19. I want to repeat, out of the 16 test results that were received today by the Ministry of Health, all 16 were negative for COVID-19. We continue the aggressive testing regime and do all that we can to keep the public informed of this progress. The knowledge we gain from testing allow public health officials to advise us on the considerations we must take into account when keeping Bermuda safe. This testing is vital, and Bermuda is ahead of the curve when it comes to the testing of our population. Today, the Bermuda Police Service announced that in conjunction with the Royal Bermuda Regiment, they will adopt a proactive stance around the enforcement of mandatory self-quarantine. We can see on the news just how important obeying self-quarantine is against the fight of COVID-19, and it is essential that every citizen in Bermuda does his or her part. Those people who should be in quarantine put people's lives at risk by being out and about in the community. We ask for the patience and understanding of the motoring public, but again, this is to save lives and to prevent our healthcare system from becoming overwhelmed. Let me return for a moment to address the issue of business closures. The list of businesses ordered to close is available at coronavirus.gov.bm under the official Gazette notices. Retail stores are ordered to close but are permitted to deliver or arrange pickup services. For all other businesses not ordered to close, we strongly advise the following. Where possible, employees should work from home. Customer-facing operations should be reduced to the bare minimum. Non-essential work in the field or requiring close customer contact should be deferred. Where work continues, businesses must observe the revised social distancing guideline for the safety of workers and customers, reducing the amount of people in any one space at any one time. There is full guidance for social distancing that will be issued following this press conference. This guidance will remain in effect for 7 days, at which time we review and adjust as circumstances dictate. And that social distancing guidance has 30 separate categories, and so we'll address all of the various categories that members of the public may have a question on. Regarding the issue of unemployment assistance, we recognize that there are large numbers of Bermudians who are now out of work due to the measures of which we've had to take to contain the spread of COVID-19. What I must state is that the Minister of Labor, Community Affairs, and Sports earlier announced that this benefit will be effective and persons will be receiving, as I announced yesterday, up to 60% of their gross earnings, up to a maximum of $500 per week. And the persons that are eligible for this are persons who are not on financial assistance. The Minister of the Minister of Labor, Community Affairs, and Sports will be administering this program through the Department of Workforce Development. And I'm hopeful that this relief, which will be funded by the Governor of Bermuda, will provide temporary assistance while we work to make sure that our economy can return back to normal. However, the most important way that we can ensure our economy returns back to normal as quickly as possible is for persons to follow the rules, obey self-quarantine, ensure that you are not putting yourselves at unnecessary risk or the public at unnecessary risk, not going out unless you have to, so that we can understand precisely the extent of any spread of COVID-19 in Bermuda through our very aggressive testing regime so that we can contain it and get things back to normal as quickly as possible. I know that for many families, having a loved one overseas and thus far unable to return increases the anxiety of this time. Following yesterday's decision by New York Air Traffic Control and its impact on flights to Bermuda, I can advise that provisional agreement has been reached for the FAA to provide air traffic support tomorrow to support a WestJet flight from Toronto. We are looking to confirm that that flight will take place and will have confirmation later today. We are working to secure confirmation from Delta to see if they will operate the flight that was canceled yesterday, but we do not have any information at this time to report. Today's cargo jet service, which is bringing essential medical supplies to Bermuda, was not affected by these challenges and will continue to fly. Unfortunately, we had an issue today with trash collection. We are working through this with the Bermuda Industrial Union and the Ministry of Public Works. I am, however, concerned that the result of this impasse would be counterproductive to all that we are trying to achieve by causing more people to be out of their homes and in unnecessary contact with others just to dispose of their trash. My hope is that this impasse can be resolved in the best interest of all of us. And here's what I have to say, that this is a difficult time, and we must all do our part. None of the circumstances of which any of us are working under are currently ideal, whether they be schools being closed, whether it be most government services not functioning, whether it be the inconvenience of stores closing and the temporary dislocation or unemployment. But this is being done in the interests of protecting lives. And I urge all of those who are involved in essential services to recognize the role of which we play to help our country be united in getting through this particular time of challenge. This is a stressful time, a time of heightened anxiety around the unknown, and in some cases contributed to by the stark images we see from other countries. My constant theme throughout has been and will continue to be one of unity. There is an opportunity to reconnect amidst these troubled times, to reconnect with some of the values that may be secondary to the busy lives that we lead. Values like personal responsibility, putting the needs of the vulnerable ahead of our own, and taking decisions in the best interest of the majority and not just a small minority. The whole world is currently engaged in an exercise of self-examination, trying to determine how this unseen enemy can disrupt so many systems that we thought were invincible. There will be plenty of times to rehearse lessons learned from this pandemic, but while we are in it, it is clear that the only thing that will get us through it is a unity of spirit, a unity of purpose, and that is the most effective way by which Bermuda will win this fight. I thank you for your attention, and I ask if members of the media have any questions at this time.
In reference to trash collection, will there be any, or do you consider trash garbage disposal workers essential? Because in some sense, there's a lot of trash piled up inside the road.
I can understand, and it is incredibly unfortunate that there is a lot of trash piled up inside the road. Garbage collection under the law is an essential service. The withdrawal of labor at this point in time while this dispute is ongoing is unfortunate. I had conversations with the president of the Bermuda Industrial Union today. There'll be further meetings tomorrow, and we are going to look to resolve this particular situation. But I have to set the record clear that at no time did anyone who was under mandatory self-quarantine break their quarantine in this particular circumstance. So we've heard lots of things that are going around, and this is why it's important for all of us to recognize where we are. Fear and hysteria will not help Bermuda get through the difficulties of which we are going through right now. We have a team of public health, which is working very hard. We have an aggressive testing regime, which is up and running. The only cases of which we've reported thus far have been imported cases, save for one, which is a close family contact of a traveler. So we are in reasonably good stead at this point in time. But we will quickly break down with our social cohesion if persons give into certain items and instincts by what they're seeing on television. Bermuda has not taken this lightly. And since the very beginning, in January, when this was announced as a public health emergency of international concern, we have been practicing social distancing, we have been reinforcing hygiene, and we have done a good job, in my view, to eliminate the spread. And I just call on all persons who are involved with it to think what would happen if essential workers decided that they were going to not go to work. What happened if our nurses, or our firefighters, or our police officers, or all the rest? This is difficult times for all, and I want all the workers in this country to know that I will continue to support them, but we all have to do our part to ensure that Bermuda can emerge from this particular circumstance stronger. If we all do our part, and if we manage to contain this virus and be able to use our size to our advantage, we can emerge stronger. But if we decide to tear ourselves apart, to say, I'm not going to do this, I'm not going to that, etc., then it will be a difficult few weeks. And I hope that we will not get there.
Does this action today put undue stress or pressure on you personally?
Oh, well, there's a lot of undue stress and pressure, but that comes with the job. I'm not going to say that it's this situation or any other situation. I think that I'm honored to lead a government that has so many hardworking ministers and a public service that is performing incredibly well. Behind the scenes, there are always disagreements. But the fact is that our public health agencies have responded well. Our hospital has responded well. The Ministry of National Security and the bodies underneath them have responded well. And all of our government agencies have responded well inside of this adjustment. I give a shout out to the teachers who, on quick circumstances, have had to adjust to remote learning. I work from home today, and I help my daughter with her work that was sent home last week. So it's a new normal for us during this period in time. But if we can come together, remember our sense of purpose, and remember that we will only get through this if we are unified by following the instructions and doing what we all have to do, then we'll be fine.
Just to confirm, my last question, just to confirm, British Airways, there will be no flights coming in and out of Bermuda, correct?
There are no currently any plans for any scheduled flights to the United Kingdom. There was some discussion with other overseas territories leaders about a possible air bridge for the repatriation of additional students. If there is repatriation of additional students, the decision was made that those persons will not be able to self-quarantine, and they would have to 14-day quarantine at a hotel, as is being done in other jurisdictions.
Good afternoon, where will people who have been told to self-isolate or quarantine be housed if they are arrested?
I'm happy to.
I'll yield to the Commissioner in a moment, but it is not anticipated that people will need to be arrested. The beautiful part of public health is that with the proper information that's provided to the public, people want to comply, and they want to do what is necessary to not only preserve and protect themselves, but also the community. So we're not anticipating that there will be any type of major disruption that will require any type of police intervention to that extent where a person will be arrested. I'll turn over to the Commissioner in a moment, but when you look at the requirements under the public health regulations, COVID-19 Regulations 2020, there's a stepped-up approach insofar as what the police powers are, as well as health officers insofar as ensuring that compliance occurs as it relates to persons that are in self-quarantine. So the final step would be something as drastic as you've indicated, but it's certainly not anticipated that that would be the case.
Sure, but in that drastic final step, we've heard that there's going to be active action on the part of police to ensure these things are done. Where will people who are arrested, if it comes to that, be housed?
There is a plan over that. I don't think it would be suitable for us to discuss it here, just because it's an operational matter for the police. But to echo the words of the Minister for Health, I think it's a remote issue for us to face at the moment. As the Premier highlighted, We begin community advisory points from this evening, where we're going to engage with the public to reinforce the advice previously given, to ensure that people are complying with any quarantine direction, and also to keep Bermuda reassured and safe. If there are necessities to deal with people that don't comply in the first instance, that will be done through communication and advice. And if we have to step further, we'll do that in consultation with the Ministry for Health and take any action that is deemed necessary. But again, just to echo the Premier, this is about us collectively working together, and the BPS are part of that process.
How will spread of the virus be prevented if someone who is instructed to self-isolate or quarantine develops the virus while in custody?
Again, we have processes. There's lots of international advice for police services, how you manage detainees that may be at risk or indeed suffering the virus. And that's an operational matter to which we've worked through the processes, and obviously we will be able to manage that situation should that situation arise. But at the moment, I don't foresee that situation in the imminent future.
Can you talk about how police officers are going to be protected against possible infection in such instances? Are police officers going to be wearing masks going forward? Will they be wearing gloves? Can you talk about that kind of thing?
No, in the use of masks, we will continue to practice social distancing, the way in which we engage with people. Gloves will be used, but we see that commonplace in our grocery stores at the moment. And obviously, it's about the cleanliness and hygiene. But in regards to personal protection equipment covering masks, that's not necessary. And also, we don't want to alarm the public by taking that step.
Premier, if I could come back to you. You provided a little bit of an update saying it looks like there's a potential WestJet flight tomorrow, and the discussions were ongoing with Delta, but nothing really to pass along. Has there been any consideration that I haven't seen? My understanding is we have a number of private jets at our airport facilities. Has there been any talk about owners of those at all, about using those to maybe help bring back some people who are still trying to get to Bermuda?
There has certainly been some discussion, and a few things have been raised. But the most important thing to recognize is that these two flights that we're speaking about, the Delta flight and the Air Canada flight, were requested by the Canadian government and the United States government. We stopped regular commercial scheduled travel to Bermuda as of Friday. The Canadian government, the U.S. government are as any other government could request if they want the opportunity to repatriate their citizens. These flights were supposed to fly to Bermuda empty and return with citizens to be repatriated. We asked for the option for those, if there are people who still wanted to fly home, in order to fly home, in order to do that. We are not expecting large numbers. I think on the Delta flight on Saturday, there were only 4 persons who came in on that particular flight. So it is not necessarily an option. It is an option that we've discussed, but it's not an eventuality of where we are at this current time.
I have a couple health-specific questions. Are 28 ventilators, which I understand is the current capacity in Bermuda, enough for a population of 63,000, assuming that 20% of those infected need hospitalizing and 20% of those that are hospitalized need a ventilator? And my understanding is that these figures are the generally accepted ones that are being kind of bandied about by health experts globally.
It will certainly be enough, Paul, if we manage the spread of the virus and do not get into a situation where our health system is overwhelmed. And that is the precise reason why we're taking the steps in which we're taking. However, I am incredibly confident that the Bermuda Hospitals Board has done the preparations necessary in order to make sure that we can get through this, and persons who will require that medical assistance will get it. That is why it is so important for everyone to recognize the importance of playing their part, observe social distancing, not breaking self-quarantine, to make sure that we do not have an outbreak that can overwhelm our health system.
And second health one for you. What, if any, estimates have you been given by health experts on what the infection rate of the population here in Bermuda is likely to be? 20%, 30%? Has any number been bandied about?
I have not received any such estimate at this point in time. I know that there is modeling that is taking place. Do you wish to add anything to that? Okay.
Can I just add?
Absolutely.
Paul, I can get the exact figures. Actually, Public Health England has actually done some modeling for the overseas territories. However, just to put this in perspective, of the percentage of the population that will actually contract COVID-19, 80% of that, those persons will have minimal, if any, symptoms at all. And of the ones that become symptomatic, the majority of those will be very, very mild. But I can provide that information to you because Public Health England is assisting with respect to modeling for all the OTCs.
I appreciate that.
Okay.
One more question, and I think that's my last one, and I appreciate the patience from everybody. Minister Keynes had mentioned last Thursday a community action plan was to be developed to deal with the homeless populations in Bermuda. I'm wondering if there's an update you can provide?
There is an update. Our third sector partners met today. We were in our EMO meeting. They are meeting proper. This is being led by Mr. Steve Cusham, and the overarching person that's looking after this is Colonel Birch. We are still working on it. As you can imagine, there are a number of moving parts. We're dealing with feeding elements, with housing elements, and so we're trying to have a complex plan that deals with a number of different elements in our community. When it is finished and it is indeed practicable, we will share that with the Bermudian public.
Thank you. Appreciate that.
I just want to ask everyone, you are awaiting, as you stated last night, just reading some of the questions that are being posed. Some 13 more results expected tomorrow. Has there been any more testing done thus far?
There is testing that is being done every day. As I indicated in my remarks yesterday, we had a meeting yesterday morning. There was revised testing methodology that was approved for Bermuda. Doctors are our first line of, I would guess, diagnosis in this particular issues. And if doctors request tests, those persons are given tests, and those tests take place every day. They collect the samples. The testing collection is going on right now as we speak. So I can't give the numbers for how many tests were done today, but I do know that tests are being done on a daily basis. We are going to be incredibly aggressive with our testing here locally, as that is the way that the World Health Organization says is how you identify and break the chains of transmission. That is what we want to do in Bermuda, so we can return to as much of a sense of normalcy as quickly as possible.
All right, and we have Dry on the line. Dry, do you have a question for the Premier?
Yes, I do. Premier, the Minister, Leader Fogo, announced some details about the government's financial assistance for people left unemployed due to the crisis. The Minister also noted that non-Bermudian people such as work permit holders will also be eligible to apply for this relief. Can you speak to this precedent?
I don't know so much if it's a precedent. This is not financial assistance. This is a temporary unemployment benefit. The fact is that there are guest workers in this country who, of no fault of their own, are unable to leave and find themselves out of work. The fact is that those persons have obligations too. And so what we are doing in this particular step is recognizing that the government cannot say that we are all in this together and then exclude a segment of the people who are resident in this country to say that you are out on your own. So it is a choice that the cabinet had made. We believe that it is in keeping in the humanitarian efforts and the sense of unity of which we must have right now. And we're going to make sure that those particular persons and individuals, many of them who are actually union members who work at our hotels, are persons who are actually being able to be compensated at this point in time. As I said, it is 60% of an individual's gross earnings, up to a maximum of $500, and we believe that is right and just in this period and point in time. The last thing that the government wants to do is start pitting people against each other when we're calling for a sense of unity in combating this disease.
Okay.
For those that are part-time workers, do they fall under the umbrella?
Anyone who is eligible, who has been let go due to COVID, can do so. But we are aware that there may be some employers who are trying to take advantage of this and trying in that way, shape, or form, not trying to pay their own obligations under the Employment Act. Those employers are put on notice and warning that that type of behavior will certainly not be tolerated. The fact is that this is temporary assistance that we recognize that we need so that persons will be able to cover their essentials, that persons will be able to make sure they can continue to survive during this period in time. Our responsibility as a country is for everyone to do what is necessary so that we can get back on our feet as quickly as possible. We do not want to go to a place where we have mandatory shutdowns for our entire economy for a period of 2 or 3 weeks because we have a healthcare system that is overwhelmed, where we have a case where there are in some countries where we have funerals where people can't even attend the funerals of your family. We are not going to get there, but the only way that is not going to happen is if people follow the rules and do what it is that they should.
My last question, how many strains of this virus have been identified? Because apparently there's one mild and there's one more lethal.
I don't know.
No?
Sorry, we don't have that, but we'll look to get it to you.
Okay, thank you, everybody.
Thank you.